gentle feet.
No. No. No.
Gentle. That hurts.
3-year-old Blake Gerlach is here at BC's Children's Hospital with his mum Cindy to meet with child psychiatrist Dr. Vic Dua.
My first concerns with Blake is the lack of speech. I had some concerns because he seemed to not know what to do with children his own age. He would get aggressive with them. He would hit them.
Blake is being assessed for autism, a disorder that impairs a child's ability to communicate and to interact with others.
Autism is a brain disorder children are born with. The best evidence we have right now is that it probably occurs with an insult to the brain somewhere in the first 28 days of gestation. What I got?
Autism is a spectrum disorder. The symptoms can range from mild to severe, and no two children have exactly the same symptoms.
There's a variety of terms: autistic disorder, autism, Asperger's disorder, Asperger's syndrome, pervasive developmental disorder. All of those terms represent one definition of a small piece of this large autism puzzle.
It's a lifelong disability, 4 times more common in boys than in girls. The symptoms usually don't appear until 18 months or later.
The classic example is a child won't learn to speak, won't use any language in any communicative way. They don't make eye contact. They may begin to engage in some repetitive behaviors like flapping their hands or finger movements or twirling toys or looking at things through the side of their eyes. Ready?
Set.
Set.
Go.
There is no single medical test used to diagnose autism. In BC, it's done by a multidisciplinary team, a speech and language pathologist, a pediatrician, and a psychologist or psychiatrist.
Children of this age, particularly the younger ones, are really complicated to assess and have a clear answer. So you really need different perspectives on the problem in order to get a clear answer. Ready, set, go.
Dr. Dua observes how Blake behaves compared to a typical child his age.
With the balloon, he was able to carry out the request to a certain degree. The extent of his request was dropping it on me. He did get it into my hand at one point.
Dr. Dua waits to see if Blake will ask him to blow up the balloon again.
I didn't get the sense, other than him dropping it on my lap and in my hand, that he was actually engaging with me, trying to say, yes, I know you are another person who has this power to blow up this balloon, and I need to get you to listen to what I want you to do and then do it. With the bubbles, he showed an interest in the bubbles, obviously, so you knew that he had some interest and motivation to want it to continue. At no point in that did he ever make eye contact with me. Even in the request, when he's pushing it down, other than when he wanted to blow it in my face. Now he did.
Yeah.
1 week after this visit, Blake was diagnosed with autism. The Autism Society of BC is often a first stop for parents looking for information about how to find help for their child.
There's a number of things that we could help you with. Probably the first thing you'd want to do is get a copy of our new parent package.
The BC government provides money for treatment, up to $20,000 a year for a child under 6. After their 6th birthday, that amount drops to $6,000 a year. This money is paid directly to the parents, and then the onus is on them to find treatment.
A parent's role is to act as, and we call it a case manager for their child's intervention, irrespective of what that is. You're the interface to the medical team, to the family. You're the interface for the school to the family. You're the interface for whatever other sort of intervention you're doing with your child.
At a point in time where you're reeling from a diagnosis and trying to deal with all the emotional issues around that, and people are telling you that, you need to do this quickly because early intervention works the best, and, you have a window of opportunity here, you're also having to read volumes on competing models of intervention. You're having to interview different consultants and say, well, which consultant would be the best for my child, or what style? Plus, it's in a culture where there's a lot of passion, and picking a particular orientation can be very difficult. So it's very difficult, I think, for families.